I gave the mother pain medication about an hour ago. Might affect the baby, I'm not sure. Let me tell you what I gave her. Let me read my notes. I gave her butorphanol, 2 milligrams given.
Hey everyone, welcome. It's the 7 days of NCLEX. We are at shift number 5. Getting into passing our state board exam. So this is the largest and best holiday event for nursing students. I see that you are here. Hello, if it's your first time, my name is Professor Regina, the #1 NCLEX instructor on the planet. And I'm here for you as you endeavor to become a great nurse, And what I love about the 7 days of NCLEX is that it draws nurses from all over to study in one place and come to a safe space. So welcome, Nigeria nurses representing. I see that you are here. Jamaica, as always, was waiting. People were representing where they're from. United States in the house. We have a global community. And so it's so good to see representation. Put your flag in the comments. Gotta love the flags of the countries that are here. So we are endeavoring to do the 5th shift. Hello, Canada. Jamaica, yes, representing. All right, so if you don't have your workbook, this is where we will be working out of for the client presentation. And it's still not too late to download that workbook. Go to remarnurse.com/7 days. All right. So we're going to be getting ready for our patient, Virginia Lee, on today. We will be getting report from Nurse Henrietta, who is going to give us a thorough report. We are going to get all the information that we need about our patient from Nurse Henrietta. Yes, she is back. And listen, I've gotten messages about Nurse Henrietta. Some of you want Nurse Henrietta to be your NCLEX tutor. You want private tutoring from Nurse Henrietta, which just blows my mind. I mean, but she is a joy to work with. So you can choose Nurse Henrietta. I'm not sure what her hourly rate is, but I can ask her. It's probably going to be something about $300 an hour because she is an expert in her field. So if you want private tutoring from Nurse Henrietta, I'll take the email. I will take the emails. However, if you don't want private tutoring from Nurse Henrietta, guess what? I have an option for you. It is the V2. And the V2 is my NCLEX review program that will take you through all of the important concepts that you need to know for NCLEX. All right. And during the 7 days of NCLEX, we have our promotional price going on. You'll want to get into this program, 3 months access for just $99. Not to be missed, because also first shift comes with this program during the promotion. And if you want to do it quicker, you get the same great program. But guess what? The promotional price is $69. So I'm looking forward to my class growing. I see the nurses that are coming in. We had several people say, I'm going to commit to the V2 platform. So I saw you in the signups yesterday, which was really cool. All right. More students are coming in as we do me a favor. I talked about us doing a dosage calculation clinic. I talked about us doing that in the next couple weeks. All right. Next couple weeks, probably like 1 or 2 weeks, give people time to sign up for it. I want to do the dosage calculation, but I heard that I need more YouTube subscribers. So if you have not subscribed to the Remar YouTube channel, I'm going to get a number to challenge us to sign up for that dosage calculation. All right. Dosage calculation. All right. But we're working out of our workbook. I am not going to forget to pray on today. So we're getting ready for a prayer, and then we will begin. We know that with God is possible, everything. And it's also Monday too. So we typically do our Monday motivation on today. I will do question and answers. One of the things we've been doing is customer support right here, and Team Remar has been getting back to me so quickly with everything that you guys are requesting. So shout out to Team Remar. But let's get ready to go into prayer, and then we will get ready to receive our report from Nurse Henrietta. And again, this is 5th shift from 7 days of NCLEX. I can't believe we're at 5 already. I've been having so much fun. I could not believe we're at 5 already. So let us pray. Heavenly Father, we're so thankful for this day today. Thank you for protecting us as we slept, Lord. Thank you for waking us up when many people did not. But you have a work for us to do, and you've given us an opportunity and a gift called time. And we don't want to waste the time that we have. Help us to clear our hearts and our minds as we focus in on education, as we try to better ourselves, and as we endeavor to become your servants in the field of nursing. Lord, there is somebody who is anxious. There is somebody who is doubtful. I pray that right now you take away that spirit, and you give them a spirit of courage, and you give them a spirit of peace, and know that in you we have victory. Thank you for every country represented, every household, Lord, just every situation and every family background. Lord, these people are blessings to their family and to their generation. So please be with us today. In Jesus' name, amen. Okay. Let's go. 5th shift. Are you guys ready for report? Let me go call Nurse Henrietta. She has a great report for you. On today, let me see, is Nurse Henrietta ready? Is she ready? I always got a clearance if she's ready or not, and I don't know. I think she is ready. It's time for 5th shift. Let's go.
Welcome back to the Nurses Station. I'm so glad to see you, Remar nurses. You're on time. You're ready to take report. I love it. That's the kind of nurse I'm looking for in you. Well, we're in the newborn nursery. Lord knows I don't need to be in this nursery. I'm going to give you your next patient. Is you ready to take report? Let me know if you're ready. Let me hear ready. And I know I can go. I'm going to give you time because you know my reports is thorough. And I want you to have all the information. And it's going to be right this time. Don't worry. I got it for you. I'm giving you a newborn baby. Name is Regina Lee. Oh, she's a big one. I'm telling you, born 10 minutes ago. Uncomplicated vaginal delivery. Mother didn't have no problems. But you know what? Let me take that back. I gave the mother pain medication about an hour ago. Might affect the baby. I'm not sure. Let me tell you what I gave her. Let me read my notes. I gave her butorphanol, 2 milligrams given. I was giving it to her. Let's see. Did I give it to a PO? Did I give it to an IV? It's in my notes. I can't remember. I believe I gave it to an IV, 20 gauge, the right antecubital IV. That's what it was. All the maternal vital signs was normal. Mother's vital signs normal. I put the baby in a bassinet with the diaper on it. So it's in the newborn nursery with the diaper on. I made sure I cleaned the diaper. It was dry. And I got it ready for you. All right. So everything else is there. Doctor came in a couple minutes ago, wrote a whole bunch of new orders for me. I couldn't get to all of them. I couldn't even read them. So I hope you can figure it out in the newborn nursery. Any questions? What you asking me about? You asked me about the APGAR score. Let me see. Did I do an APGAR? Oh, Lord, I'm in deep trouble. You know what? No, I did an APGAR score. I did one when the baby was 1 minute old, because that's when you're supposed to do it. That's right. I did one at 1 minute. It was a 7. So I did do the APGAR score. And I need to tell you the baby's weight. Baby's weight, 9 pounds, 9 ounces. This is a big one. What else I tell you? Everything else is in my notes. You read the notes. Let me see the notes. Tell me everything. The note. Read my note. Now, I want you to have a good shift. I'm going to get out of here. I'm going to look for Mark. See if he want to pray with me before I go home. You seen Mark anywhere? You seen him? Not yet. Okay. I'm going to go look for him myself. I'll see you on the next shift. You're doing a good job here, Miss Henrietta. Very proud of you. Very proud of you. And I believe you can, you will, and you must pass that NCLEX. You going to pass it. I know you is. I'm going to see you. Now, see you. Show you the baby. I'm going to show you the baby. Yeah.
Okay, so Nurse Henrietta gave us a report and we see how she left the baby. So let's look at what I was able to gather from the report and from the nurse's notes and everything. So we have here, we have Virginia Lee. She was a female born 10 minutes ago. The baby is 9 pounds, 9 ounces. Now look at that baby. Did that baby look content? Right? It was an uncomplicated vaginal delivery. She gave the mother butorphanol, 2 milligrams IV for the baby. She did an APGAR at 1 minute, and that APGAR was 7. Now, Miss Henrietta should have done what? She should have done an APGAR at 1 minute and then another APGAR. Oh, man. Nurse Henrietta. Nurse Henrietta. All right. And she left the baby. She left the baby in a bassinet with the diaper on. Nurse Henrietta. Gotta love her. So we already know we are missing some things. And I'm working out of the workbook. I gotta find my notes because this one sometimes is hard for me to follow. Y'all know pediatrics is this is maternity, I meant. Okay. Yes, exactly. She left that baby in the bassinet. All right. Baby is just born. All the maternal labs were normal, she said. And she said the baby was big. All right, let's see what we missing a whole lot. We're missing a whole lot, but we're gonna work with it. So here's the note. If you don't have the workbook, here it is. So we have the baby here. Infant was recently born, 39 weeks gestation. Amniotic fluid appeared clear. Infant's weight 9 pounds, 9 ounces. Molding of head noted. Lungs clear. Pink with acrocyanosis. Lethargic. Says weak cry. Appears jittery when awake. No stool since delivery. The baby voided ×1. Henrietta Clark. Okay. We have that as the nurse's note. Nurse Henrietta also told us that the doctor put in a lot of orders she wasn't able to get to. So here are the orders. The weight daily. Thank you, Nurse Henrietta, for doing the weight. So we got the weight. Vitamin K supposed to be given within 1 hour of birth. So what's that vitamin K for? Do we need to give that vitamin K? Okay. The diet is not there, but it's a diet order. Erythromycin ointment to each eye in the lower conjunctiva sac to each eye. So do we have any issues here? Do we need to give that erythromycin ointment? Then there is a half normal saline bolus for lethargy and jitteriness. And then it says administer sucrose solution, 1 to 2 drops on the tongue. And then this may repeat 6 hours PRN. So these are the orders that we are given. You should be looking at these orders. We're practicing looking at orders objectively. Okay. So, I mean, we're not just taking them for face value. We are actually looking at them to break them down. Our vital signs that we have here for the baby, we have a heartbeat of 160, 165. The respirations are, if we're looking at trends, they're trending down a little bit. What's the temperature doing for this baby? And then also, what is the pulse ox of the baby? Oh, and then we also see the glucose levels, as well. So we have some things, right? You have some things going on with this baby, and I'm wondering if we are prepared to help this baby. All right, so here's my first. We're getting into the workbook. Remember, this isn't in V2 yet. We will be going into V2. We're going to do the newborn assessment. So if you're starting a newborn rotation or you need to review this is a weak area, this is a great review for you. So let's get into it. We saw our baby. So come on, Remar nurses. Right now, what is the priority question to ask? Okay, what is the priority question to ask about the mother's history? What's the one thing we want to know about this mother's history? Like very quickly. I saw some people already put it in the comments, but do you know what's the one thing about the mother's history that we need to know? Exactly. Yes. Diabetes. What's going on with this baby size? Hey, I got some nurses. Yep. So great. That's what I have. That's what I wanted you to be thinking about, because this is a consideration. Was the mother diagnosed with gestational diabetes? That is what we need to know. And then think about, what are some cues that led you to this? What are some things that made you think this might possibly have been a complication, even though Nurse Henrietta said that this was an uncomplicated vaginal delivery? What are some things? I have here the size of the baby, the report that the baby is jittery when awake. But, usually larger babies, we are thinking about, is this baby from a mother with diabetes? Okay. Next question is this. In the notes, it stated that the amniotic fluid was clear. What is the significance of clear amniotic fluid? Why do we care that the amniotic fluid is clear? What's the significance of it? Is that a good sign or is that a bad sign? Amniotic fluid being clear. Good sign or bad sign? This is something we do want to look for. It is very important. It says good sign, no infection. People say, oh, it's a bad sign. No fetal distress. Okay. So we're all learning. We're coming in. Good. It's normal. Okay. And remember, we all have different experience levels. Some of us haven't, really studied this in such a long time. Clear amniotic fluid indicates the absence of meconium staining. Look at this comment, which reduces the risk of meconium aspiration syndrome or pneumonia. It suggests a less complicated delivery, though other risk factors. Okay, I love it. Bringing on the good comments. So, like you guys are saying, it means there was no fetal distress during labor. When labor is stressful on the infants, they will release stool as a stress response. And we don't have to worry about that stool as it's floating in the amniotic fluid getting into the newborn's lungs. All right, because the baby's going to take its first breath when it passes through the birth canal. And so if there is stool, it's possible for babies to inhale that. Yeah. So green or brown fluid means meconium is present, and that is a whole different treatment alternative if that is the case. All right. Third question is this. We need to do a 5-minute APGAR. We're doing a very late APGAR, but we need to do it. So what will our score be? And remember, the APGAR scale is something you have to have memorized. They will not give you the APGAR score standards, normal values. So you have to have it memorized. So if the heart rate is 160, remember each value, each characteristic is between a 0 to a 2. So the heart rate 160, what will we give? If respirations are documented as weak, okay, weak respirations, what will we give for that? The muscle tone, active motion. The reflex is grimace when stimulated. And then the appearance, the arms were pink, but the legs were blue. What are we going to give? And this is a value that you will have to have memorized. APGAR score. It's a big thing. Know it, love it, study it. Okay, so I see different answers. I see a lot of different answers here. My answer that I got was this. 7. I got a 7. Did you get 7? So the heart rate, and this is something that we go over. We go over this in V2 in the lectures. So if you are not familiar with this, you can actually do the entire maternity lecture probably in a day. So I would just say, just do it. So you can go over this. So the heart rate, we would give a 2. The respirations would be a 1 for weak respirations. You got it? Yay! Muscle tone, active motion, 2. Grimace when stimulated, 1. And then acrocyanosis, 1. So that's a total of 7. Whew. Okay. So if you got that on NCLEX and you got a 7, you cleared it. Safe nurse. Okay. All right. Here's a great question. Based on the APGAR scores, should resuscitation support occur? Hi, Ashley. I love this comment. This is my favorite comment right now. I finally memorized it with your V2. Nice. Shout out to Ashley. She's been a regular coming. How many people have been coming? How many people are 5 for 5 at this point? Here's a great question here. Based on the APGAR score, should resuscitation support occur? Oof, I see some no's and I see some yeses. This is a huge safety point. Okay, if you don't get this, don't put at the end that you were a safe nurse, because this has to be right. All right, correct answer here is boom, yes. Resuscitation should occur. Got to think critically. The baby has acrocyanosis and it says weak retractions. So absolutely, we are going to be doing resuscitation support. And that means just helping the baby to oxygenate. All right. And even though that number is 7, yes, the baby is, for all intents and purposes, normal, but they do need some support in some areas. Okay. So we're going to do that. What other immediate action should the nurse take? There are some things that the baby should be doing right now as well. If you were in that, if you walked in that room and you saw that baby, what are some other things you would do quickly to that baby? How many people in here are interested in being in that labor and delivery room? I know I am. I'm literally wanting it. I want it. You guys don't know. It's the call of maternity unit is pulling me. I don't know. I love Remar, but I think I love this too. So some people are saying I would do skin to skin. I would cover that baby up. Oh my goodness. I would cover that baby up, put a hat on that baby. All right. I see that. I see it. So cover up the infant, because we can see in the vital signs what? The temperature is dropping. Did you catch that? The temperature is dropping. Start oxygen on the baby. Okay. And repeat those vital signs. Feed this baby. This baby needs to be fed. Somebody said, not me. And we need to notify the doctor about the glucose. Warm this baby up. This baby is cold. Nurse Henrietta, dead wrong. She dead wrong for not putting a hat on the baby and a blanket on the baby. I think we might have to write her up again. Okay. Next question. The doctor calls with orders over the phone. After transcribing the orders, what is the most important thing for the nurse to do before hanging up the phone with the doctor? Give it to me. Give it to me. What should the nurse do before hanging up the phone with the doctor? This is for RNs. This is for PNs. Yes. Very good. Very good. Yes. Do this. Do this. No matter how in a rush that doctor is, because I will tell you, doctors don't necessarily like to do this. They don't like to do this. They want you to get it right the first time. And so that's why in nursing, we have to make a very big deal about this, because you have to stand up to the doctors. And this is something I want to say just as something from my first shift book, How to Dominate Nursing. Okay. Listen to me very carefully. Some new nurses believe that the doctor is in a higher position than them, meaning you feel, or you tend to feel like the doctor is your supervisor. The doctor is not your supervisor. You are in totally different disciplines. So the doctor is your work colleague. He is not your supervisor. You have a nursing scope of practice. He does not do the same things that you do. You do not do the same things he does. So just as you respect him for his knowledge, the doctor, he or her, needs to respect you for your knowledge. So don't ever feel like really intimidated, like, oh, if I don't do what the doctor says, he's going to get me in trouble, or I have to, bow and do everything. No, the doctor is your professional colleague, just like the respiratory therapist, just like the dietitian. We don't put that same pressure on ourselves when respiratory therapists come in, right? And so we don't need to put that pressure on ourselves when the doctor comes in. Okay. All right. That's my mentorship tip of the day. Now, we need to read back and we need to verify the order, because everybody in this profession is what? We're all humans. And so we all can, and we have the ability to make mistakes. All right. All right, here we go. What is the anatomical location to obtain the client's blood glucose levels? We're talking about the infant. Where do we get the blood glucose levels from in our infant patient? Okay. All right. Good job. Good job. I think some of you have it. I think you have it here. So it says we get it from the toe. We get it from the heel. We get it from the leg. We get it from the hand. I'm seeing all these comments. There is one place that is right, and it is the heel. Now, here is an important question. Okay. We're going to do the heel. Do you get it from the side of the heel or the middle of the heel? You get it from the middle, or do you get it from the side? And Jamaicans will say foot bottom. Okay. It is very important, though, for us to think about. Okay. I'm bringing this up for a reason. I never have you guys doing anything for just to do it. It's very important. Okay. So I see the middle of the heel. I see under the toe. I see side of the heel. What do you say? Okay. Correct answer is the side of the heel, the lateral aspects of the heel. How important is this? Because what happened when a nurse, and it has happened before, it's a big thing. When a nurse uses the middle of the patient's heel, what can happen? Let me show you. Okay. When you puncture the middle of an infant's heel, that can happen. Do you see that? Okay. I want everybody to see this. When there is middle of the heel punctures. Whew. All right. Now, what does this baby have going on? This baby has developed a bone infection, osteomyelitis. And because this is an infant, you are not able to treat this aggressively. And so what happens is the tissues begin to die. And when this happens, the baby is at risk or will possibly lose this foot. And this is a healthy infant. And this has happened because of a nurse who has passed the NCLEX and is practicing, however, is not a safe nurse. Okay? So I bring these things to your attention so that when you take one of the Safe Nurse Now jobs and you're working on that unit, you don't have these issues. Because as nurses, we need to be able to be flexible, and we should be able to literally do general nursing care. So even if you get floated to the newborn nursery, there's just certain principles about taking care of an infant you should know. There's just certain principles about taking care of older adults that you should know, and 5-year-olds and 10-year-olds, okay? And so this is totally unnecessary. Totally unnecessary. We will remember this as REMAR nurses. We won't do this. All right, I'm moving on. Lateral aspects of the heel. Okay, all right. All right, so let's prioritize these nursing actions from first to third. There are 3 actions that I want you to prioritize for this infant. The first one says, place infant in a warmer. The second is perform heel stick to assess glucose levels. And we know that's the side of the heel. And then the third is administer sucrose 24% solution. Give 1 to 2 drops on the tongue. And that was one of the things that the doctor had requested us to do. So what are we going to prioritize? What's the first action? What's the third action? And second action, what's the third action? And I see here people are saying, I'm just going to do 1, 2, 3. Oh, I'm so glad we covered this. I'm so glad that we covered this because, again, if you haven't been in the newborn nursery, but you get questions like this on NCLEX, you want to be able to do it correctly. The order is, boom, it's 1, 3, 2. 1, 3, 2. What's the purpose of the sucrose? When we talk about administering sucrose, because everybody got the first one right, we need to put the baby in a warmer. That's priority. Okay. Hypothermia, we need to be able to rectify that. The sugar that we're given in this situation is to decrease the pain of the heel stick. So the sucrose that we're given here is not for the blood sugar. It is because this heel stick that you are about to do to the baby is going to be painful. Okay, so this is a soother. It's a soother. We do this before babies get heel sticks. We do this before infants get circumcised, right? For the male infants, it's something to take away the pain. Did you know that previously it was thought that babies did not feel pain? And so physicians used to circumcise newborn baby males without any kind of anesthesia or any type of pain relief. Horrific practices. Horrific. I'm so glad we have come so much further in our healthcare and Western medicine that, okay, that we prioritize the feelings of even the smallest patients. So the sucrose is to give a pain numbing sensation before you do that heel stick. All right. So, where do I want to go with this? Let me just keep going. All right. Let me just keep going. All right. I like this. Yes, they call it a sweetie pacifier at my job. Yep. In the hospitals, they will call it a sweetie. They'll call it a soother, and it will help to decrease the pain. Which vaccination can be offered to the parents for this infant? So there are some vaccines that we can administer during this baby's time. What vaccination would that be right now? Because we saw vitamin K is ordered, which we can give vitamin K typically within the first 7 days. Babies don't have the clotting ability. So more specifically, it's important for males who are going to be circumcised. If you have a baby boy and he's going to be circumcised in the hospital, you want to make sure that vitamin K has been administered, because the baby will be in a bleeding situation if not. Okay, here we go. I see it. Yes, it will be hepatitis B. It will be hepatitis B. This is the one that will be offered for the infant. And so parents can decide if they want to do it, if they don't want to do it. I saw a good comment where the comment was pertussis. Pertussis is not offered for the infant, but I think it is recommended for those who are taking care of the infant to make sure that they are up to date on that. So they'll offer it to the mother, pertussis. Okay, good. Next question is this. I want to do another point, but it may come back up. The nursing concerns with the doctor's orders. Let me try to pull that back up for those of you who don't have it. The doctor gave Nurse Henrietta a lot of orders. Where is it? That was what she did. That was the nurse's notes. Okay. All right. These were the doctor's orders. These were the doctor's orders. What concerns us about these orders? What concerns us about these orders? There are some offenders here. And even like the MAR in general, but I want us to really focus on the medications right now. What concerns us about the medications here? Yep, you see it. You see it. So if let's just go down. We have the weight daily, that's fine. Vitamin K within 1 hour of birth, that can be given for sure. It wasn't given, so that's a concern. There's no diet, whether the baby is breastfeeding or bottle feeding, that's left blank. So that's up to the nurse to know. All right. The erythromycin ointment. What's the problem with the erythromycin ointment? The doctor has misentered it, or maybe they checked the wrong box. But is this erythromycin ointment appropriate? No. So I'm kind of glad Nurse Henrietta didn't give this erythromycin, because the erythromycin says to be given 3 times daily. 3 times daily? No. We don't do that, right? So it's not, I like that, Rena. It's not continuous. And then this IV fluid, why are we giving half normal saline? Did you catch this? Half normal saline for lethargy and jitteriness. Is the half normal saline going to do anything for this baby? Half normal saline is not going to affect this baby's blood glucose levels at all. So this fluid is inappropriate. This fluid is totally inappropriate. We will be looking for something with what? If we wanted to raise this baby's blood glucose levels quickly, we're going to be looking for something that has a little bit of what in it? Yes. A little bit of dextrose. That's what we need. We're not. Okay. Or we could give something else. We could give glucose or something else, but this half normal saline is not going to be appropriate. All right. And remember, this is for the baby, not for the mom. And the reason why we are looking at increasing the baby's blood glucose level is just basically because of the lab values that we have been given. So let me go back to, I can't remember which one it was. Let me go back to our, where we were in our questions. Yes. Nurse Henrietta missed this one, and she should not have missed it. So when I asked here to give me the issues with that, I am looking for, let me go back to this question. So the erythromycin, you guys got it. The erythromycin ointment only needs to be applied once. Low glucose needs treatment. That treatment is not there. Normal saline, half normal saline doesn't work. Okay. Needs a warmer. This baby's temperature is dropping. We have not addressed the temperature instability. Great catch there. We probably need to order for O2 right now because this baby, the oxygenation is dropping and the nutrition needs to be established. Okay. The nutrition needs to be established. So after doing the scenario today, were you a safe nurse? Is this your jam? This newborn nursery, maternity, you knew the infant needed a warmer. You knew that heel stick should be in the lateral aspects of the heel for osteomyelitis, erythromycin, you caught that. You knew about the sucrose before the procedure and after the procedure. Are you good here, or do you need more assistance in this area? And let's just keep it real, because this is what 7 days of NCLEX is about. It is about being able to evaluate these 7 days. Are you showing up for yourself? And then also, are you identifying weak areas so that you are able to, remediate? And so I like it. People are like, yes, this is my jam. And some people are like, yes, I know this stuff, but I don't want to work here. I don't want to do this. Some people are like, I learned a lot today. So I'm feeling confident. And this is a great sign, because you always should be in a position to learn more. Even if this is one of your favorite loved passions, you still are able to learn from it, right? Love it. And I've been really loving these scenarios, and I love what Nurse Henrietta brings to the table in terms of a very real and common experience. Okay. That means you always have to be critical. So as this experience is closing, I want you to get into the V2. I keep going back to it because this is where the real learning takes place. 3 months, $99, or do it with me for 1 month. All right. 1 month. And the investment is $69, which I think is so reasonable for the training that you're going to get. Speaking of the V2, it's time to go into the V2. We are going in, and we're about to watch normal, and we're about to watch high-risk newborns. And so really quickly, if you don't have the workbook here, that's okay. You can take notes. We're going to do normal and high-risk newborn. Also, this is a subject for you to get back out your V2 student workbook, and you can turn to page 13. Okay, you can turn to page 13, and we will be filling out notes for normal and high-risk newborn. I've been filling out notes. I've really been trying to do my workbook, because even myself, I learn every time I study. So let's get ready to take notes for normal and high-risk newborn. All right, are you ready? Okay, let's go in here. I'm going into the V2, and normal and high-risk newborn is right in the beginning. So let's go. Oh no, hold on 1 second. Let me, I waited too long, and now I gotta go. Oh, I gotta go. All right, I gotta start all over again. Let me sign back in. Oh no. And I'll do questions and answers afterwards, I promise. Let me start this from the beginning. There we go. let's get into the normal and high-risk newborns. If you love babies, you will love this section. They are so super cute just watching them. You have to know that APGAR score, and that is a scale that you must memorize before you take your NCLEX exam. Remember, the APGAR score is done at 1 and 5 minutes after birth. There are 5 categories: heart rate, respirations, muscle tone, appearance, and reflex. Each category, a baby can get from a 0 to a score of 2. So let's go through the categories and look at the characteristics that would give a baby a 0, a 1, or a 2. If we're talking about heart rate, a score of 0 is given if the heart rate is absent. A score of 1 would be given if the heart rate was below 100, and a score of 2 would be given if the heart rate was at or above 100. So guys, if NCLEX gives you a heart rate of 100, you're going to score that baby at what number? 2, right? Respirations, a 0 if there are no respirations, if the respirations are absent. A 1 if the baby has weak gas, and a 2 if the baby has a good, strong cry. The muscle tone of the baby, a 0 would be if the baby was flaccid. Flaccid is a term that means very limp, very loose. A score of 1 would be given if there was some flexion in the baby's muscles. So perhaps the legs are really flexed, but the arms are limp and flaccid. And a 2 if the baby is well flexed, pulled in tight. That's what you would give the baby. Appearance or color, a score of 0 would be given if the baby was cyanotic. A score of 1 if the body was normal, but the extremities were blue. And a score of 2 if the body and the extremities were a normal color. Reflex or irritability, the scores are a 0 if there is no response. A score of 1 if there is a grimace or facial change. And a score of 2 if the baby has good reflexes. If you think about the score at 1 minute or 5 minutes, I want you to remember the score at 5 minutes is more valuable. In the eyes of the newborn, all newborns will get that erythromycin ointment, and they may not be happy about it, but it is for their good because the eyes need to be protected if they've gone through the vaginal birth canal and the mother has had some STDs. The temperature of the newborn, the first temperature should be 98.6 degrees. Babies do have a hard time staying warm, so we have to be mindful to make sure that their temperature stays normal. The pulse normally is 120 to 160, and the respirations are 30 to 60. Hey, in the abdomen, there are 3 umbilical vessels. You need to know how many arteries and how many veins. Do you remember? It's 1 vein and 2 arteries. I like to use the mnemonic device AVA. AVA stands for artery, vein, artery. And then I don't forget that. Let's go over some cord care client education for our registered nurses. This is what we tell those clients. When it comes to the umbilical cord that has been cut, we need to allow that cord to air dry. It should not be washed daily. By the 7th day, the cord should actually have fallen off. But during this time, we need to monitor for signs of infection of that umbilical stump. And what we would notice would be localized redness or tenderness, or maybe even some pus coming from the area. We would tell the client to definitely notify the pediatrician or healthcare provider at that time. Now, the high-risk newborn is, number 1, the drug-addicted newborn. And the drug-addicted newborn was the baby that was given illegal substances during pregnancy. Let's talk about what that baby will look like and behave like. The nurse would notice a high-pitched cry, poor sucking ability, which means these babies will have a difficult time eating. They will be irritable, and they will have higher than normal vital signs, such as their temperature, their heart rate, their respirations. Here is a critical thinking question. What is the best way to test for illegal drugs in infants? What do you think? The best way. I hear your minds turning. I hear you. The best way is to do a urine drug screen. Yeah. The nursing care for the drug-addicted newborn is what we call cluster care. And that means focusing on doing the treatments all at one time. And the cluster care is really, it's a supportive care measure. There are not a lot of treatments or interventions that are done to the drug-addicted newborn. Sadly, they have to go through withdrawal to get those illegal substances completely out of their system. But there are some things that you can do to help, such as turning the baby on the right side lying position, elevating the head of the bed, not handling them so much, so decreasing the amount of touching and stimulus that they have. And it's also okay to give a pacifier or a soother to comfort these babies. Let's go over the interventions for the mother who has HIV that just delivered a baby. The first point that I want to talk about is the isolation required. What isolation is required for the HIV mother? What do you guys say? It is going to be universal or standard precautions. Okay. The second point, do you think you can give the baby the mother's breast milk? No, the mother is not able to breastfeed because the HIV virus can be transmitted through breast milk. Third point, can the baby stay in the mother's room? What do you think? Yes, the baby can stay in the mom's room. We also teach the mother, do not give the baby live vaccinations until after the baby has been confirmed as not having HIV. And if you guys remember, this can take up to 18 months. So if we're teaching the mom not to give live vaccinations, what do you think some examples of live vaccinations are? Let me give you a clue. Some of them are MMR, varicella, and oral polio. Whenever I'm teaching in class, I hear students yell out, the flu shot. The flu vaccine, influenza, is not live, okay? Can you give the vitamin K shot? That is the final point. What say it, you guys? Yes or no? Vitamin K. Is it going to be helpful to the baby? Absolutely, because the vitamin K is going to help the blood to do what? It's going to help the blood to clot. Now, remember this safety point for NCLEX. Clients with HIV can never donate blood. Never, never, never at any point, even if they have been receiving treatment. I want to talk about two more conditions that will make a newborn high risk. And the next one is fetal alcohol syndrome. When you think about a baby who was given alcohol during gestation, they are going to have certain characteristics. The first is that they are going to have a low birth weight. These babies are going to be smaller than normal. They are typically going to have some facial features that are different as well. They will have a flat nose, small eyes, and thin lips. there is a risk for mental retardation, which of course is cognitive impairment. When you think about the treatment for fetal alcohol syndrome, I want you to know for babies, the treatment is essentially they have to go through withdrawal. But one thing about babies that are born with fetal alcohol syndrome is that they actually like to be held. So they receive comfort if nurses or their parents are holding them. The next high-risk newborn that I want to talk about is the baby born with spina bifida. Yes, spina bifida is a known neural tube defect that has an unknown cause. You know, most mothers who have babies with folic acid deficiency will have issues like spina bifida. So that's why it's very important for moms to take folic acid when they're considering becoming pregnant or they are actually pregnant. Because with spina bifida, the spinal column is partially exposed, we need to watch for fluid buildup problems. Yes, the circulation is not 100%, as you can imagine. The treatment for spina bifida is shunt placement to drain the fluid. Also, surgery may be required for the infant. The problem is that when babies are born, they are not prepared to undergo surgical procedures. So they need to be nourished and they need to grow first. Now, a major safety point for NCLEX is the position of a baby with spina bifida. Because there is an exposed spinal column with a pouch or a sac on the back of the baby, we need to keep these babies in the prone position. That is right. These babies need to stay on their stomach to protect that sac. Now, this is a big challenge because babies do not like to be on their stomachs. They like to be on their backs. So a baby with spina bifida who is placed on the stomach, are they going to want to eat? Probably not. So it'll be a challenge for the nursing staff and the parents to make sure that this baby gets adequate nutrition. Those are the top NCLEX points for spina bifida. One more that I want to talk about is the baby born with cleft lip and cleft palate. Now, this is most commonly seen in Caucasian babies and males. The treatment is a cheiloplasty or a palatoplasty, where there is actually a surgical correction of the deformities. The client education for the parents is when feeding, do not use straws for this baby. I know it seems like a good option if you see it on NCLEX, but the correct answer will be to use a regular nipple with a larger hole placed in it. Because these two deformities require surgical correction, an elbow restraint or a Logan bow may be used after the surgery so that the baby does not alter any of the sutures. An NCLEX tip for these babies are that nutrition is going to be a major concern for both of these birth defects. So those were my NCLEX points about the normal and high-risk newborn. The next topic will be infant heart defects, and you're gonna want to stick around for this. Okay, that was a section from the beginning portion of the NCLEX V2. And remember that what I say when you're studying for the NCLEX exam, you should not be studying more than 3 hours per day. And you should spend the majority of your time doing that prep work of listening, reviewing, and taking notes, because this is where you struggle with, am I growing through this process? Am I being consistent? And is it showing up in my questions in terms of, am I getting questions right because of this work that I'm doing here? When we tend to do just practice questions, we tend to have a higher confidence in what we know without actually going through the process correctly, right? So we're relying on rationales to teach us as opposed to our own reading and study time. So that is how somebody can literally do 3,000, 4,000 questions and fail the NCLEX. It's because this work of reviewing is skipped. And I know sometimes it's not fun to do. It's just funner to just attack the questions and get that practice score. But honestly, that's going to be the least helpful, especially if you've been out of school for several months and you are trying to catch up. All right, practice questions are not going to teach you. So as we move into 2025, wouldn't it be great to be able to have your nursing license? Wouldn't it be great to be able to finally clear this portion of your nursing experience, right? Because some of you are ready to be masters in the field, but you're still students because of this one thing. All right. So 7 days of NCLEX, it is the restart button. It's the restart button. And if you have this is so amazing. This has been a godsend for me. I've been out of school since 1996. I'm so happy, Pamela, that you have decided to join this special event, because this is a special event. It really is. And it's something that we put a lot of effort to get you here so that you can have this experience. So thank you so much for being here. We are having 2 more days of 7 days of NCLEX. So tomorrow we have class at what time? What time is class tomorrow? Because I'm going to be right here, God willing, on time tomorrow at noon. Okay, tomorrow at noon Eastern time. Well, we have 2 more classes left, and then we will go away to study in the V2. We'll be here tomorrow at noon. If you want to get into the V2, please check out the website, remarnurse.com. Go in there and sign up for it, because in the month of January, we will be doing the challenge. We will be doing the 30-day challenge. And if you have V2, you can do the 30-day challenge along with me, and you will get emails every day and quizzes that I will be going over about the calendar, right? Everybody that gets V2, you will get the study calendar included in the file vault. And so if you're following that calendar, we will be doing the study, the challenges together, okay? Let me do a couple question and answers really quickly. This has been really helpful to the community. I've been out of school for 17 years, never practiced, okay? I'm confused on how and where to start NCLEX prep. Well, the great news is you don't have to go back to nursing school in order to pass NCLEX. If you've already done a formal education and you have been granted a diploma from that education, you can start right in your NCLEX prep. This is the way that I do my course when we are doing I'm gonna show you really quickly the order of the lectures that I like to go in. So if I were to start, let me go into V2. If I were to start at any subject, where would I start? For me, it makes sense to start in what we did today. Hold on, let me take this off. Pregnancy and labor and delivery. I think starting here from pregnancy and then working your way through essentially the care of older adults into expected changes in aging. This is the way that I start. Oh, let me remove this so that you can see. So these are the orders. I start with pregnancy, I go into pediatrics, and then I go into aging, essentially geriatrics. And then I talk about the different components of care for these age groups. And so when you have that foundational review first, then you can begin to add on medications and treatments to that. But please, what I don't want you to do is this. I do not want you to study by body systems, all right? Because that kind of mentality, and I know there's some reviews that are structured that way. If you say, okay, I'm just focusing on renal, then I'm just focusing on respiratory, I'm just focusing on cardiology, it doesn't allow you to see the big picture and how it all works together. So that's how I would say to start, all right? Will buying V2 do it for me? Yes, that's the whole idea. That's the whole idea. You got a chance to experience it today. So how do you feel after watching that lecture video that you just watched? Let's see. What else? All right. Is there practice for pharmacology prep? So pharmacology prep for NCLEX specifically can be done by reading Quick Facts for NCLEX. Okay, that's my book, Quick Facts for NCLEX. I would definitely refer you to there as part of the program. There are also some videos in the V2 on how to apply pharmacology to the human body. All right. Okay, if you sent emails, Team Remar is absolutely answering emails today. Can you speak on scoring for the NCLEX to passing standard? This internet is confusing a lot of students, okay? Do we have to get 50% of the difficult level correct to be passing, or do we have to answer all the questions right? Okay, so yes, let's talk about this. So the passing standard, how it works is you have to remember that the NCLEX is not graded like your typical percentage grades we get in nursing school, where you get 86%, that's a B, that's good. You have to get, it's a probability exam. So the probability exam means that the exam is going to be guessing and evaluating your performance in the future. So you have to read a certain logics in order to pass. You have to have a certain confidence level that you've triggered, that based on your performance, there's a 95% confidence level that you would be able to complete the entire test plan successfully in all aspects of it, right? And so when you talk about percentages, the where 50% comes in is that the logics, or the probability, is that you reach a 50% passing score of all of the questions. So that means that for RNs, that if you are given 100 questions, you would get probably 50% right? And so that is where that 50% comes in, and that's just what it is, right? So when NCLEX says they're looking for the minimum competency level, it's really the minimum, because that probability in logics could have been 80% or 85%, but no, it's about 50%. Can you post the link for the 30 days? Remember, I went into the V2. The 30 days is ready for you in the V2. If you go to the 30-day challenge right here, you can click on the 30-day challenge and you can get started as soon as you get your books. All right, as soon as you get your books, you can start the 30-day challenge. So you don't have to wait for me. Okay, you don't have to wait for me. All right. For the PNs, the last time I looked, the number was a little bit less. It was like 48% for the PNs. Hey, I like this one right underneath from YouTube. Hi, Regina. I did my NCLEX RN on the 16th of December from Kenya. First attempt and pass. I use V2 and Quick Facts. Thank you so much for making it easy. Oh, man. How cool is that? Congratulations. That is not easy. And which is really cool. I don't know if you're still in Kenya, but you have your USRN in Kenya. So you're a US nurse right now if you're in Kenya. That's really cool. That's really cool. Okay. Yes, Katrina, I can follow up on your book if it's in Africa, if it's on its way to Africa. Absolutely. You sent the email. Did you send me an email? Is the 30-day challenge free? It is free. Yes, it's free. What else? I'm testing on January 15th. I can, I will, and I must pass NCLEX. I'm done with the V2 videos. Yet to take my cat. A word for me. Yeah, in the last 2 weeks of your NCLEX prep, this is when I say you can be focused on practice questions. So this is where you should be doing practice questions, take the CAT exam, also really get into the habit of just going with your first mind. So being intentional about that, like say, okay, I'm going to do 20 practice questions. I am going to go with the first feeling. If I feel that it's correct, I'm going to pick it and I'm going to see how that shakes out for me, because breaking that habit, if you have it, is really tough to do unless you're really intentional about it. So go ahead and do those practice questions and count down the days. All right. I got a call from my brother this afternoon that he has been called to come for the Quick Facts book. Thank you very much. Perfect. Thank you. That's so good. All right. What else? I must have missed this question from Shakira. The V2 for NCLEX, Team Remar is saying this to you. The V2 for NCLEX has a structured order and must be done in sequence. The nursing school V2, the nursing school V2 is open. All right. Let me make sure my audio. How is my audio? Okay. So, what else? You're in the right channel. Keep participating. Thank you so much for everybody who is watching. Just give me one moment. All right. Somebody's saying this. When should I receive my physical V2 workbook? It should be coming. It should be coming to you soon. Can I, let me show you really quickly where you can get your downloadable V2 workbook, because if you go into the file vault, if you have the physical V2 workbook coming, and yes, the other videos are available for a short period of time. If you have your physical V2 workbook coming, but you want to get started and you maybe just want to do maybe just print out 10 pages of the downloadable so that you can begin. If you go to your course resources, you're going to see that, not the study calendar, you're going to see the physical workbook in the file vault. Okay. So you can get the student workbook and just print out the pages there until your other workbook comes in the mail. All right. So let me say this. I have the download. Thank you. Perfect. I'm taking pharmacology calculation dosage next week on my first day of class, and I'm anxious already. Catherine, are you if you're in the nursing school, or if you get the nursing school V2, you can go over those videos for dosage calculations. You'll feel much better. Can I download the V2 Enable to help me with my workbook? You can't download the V2. You can get the app though. And if you have an account in the V2, you can get the app to watch these videos there as well. Okay. If I purchase V2 but delay my start date, can I still join the 30-day NCLEX review course in January? So you can join it still. You can still get the emails from me and do the quizzes. You just won't be doing the content. All right. So yes, it's possible. I'm confused on how to order my physical V2 workbook. Okay. Let me know, Catherine, do you already have V2 or are you planning to order V2? Because I can show you both, but I want to know specifically where you are. Let me know, Catherine. I'm joining and plan to go back for my LPN. What books do I need? So you need to get the V2 course, and the V2 course will come with, Quick Facts. Let me say this. You need to get the lectures, okay? The books are great, but it starts with this. So you're going to get the NCLEX V2, which are these videos, okay? And then this course is going to come with Quick Facts for NCLEX. This is RN or PN, okay? RN or PN. And then you can download your V2 student workbook from the file vault like I just showed, or you can add it to your order if it's a physical book that you want me to print out. Okay, Catherine says, I would like to order. So let me just do this. Okay. All right. let me just go and show you how you order and how you add that physical workbook to your order. So allow me one moment, please. And then I'm also reading these questions on the exam. Why is the clinical exam so difficult? I actually, on TikTok, I took that exam with one of the nursing students. Me and her went through the PN exam together. So let me know. Let me know. Maybe I'll do that. All right. So if you go to my website right now, Catherine, if you go to my website right now, you're going to see that I have 4 entries into my course. It's NCLEX RN, NCLEX PN. If you want the nursing school course, the nursing school course has the anatomy and physiology. It has the fundamentals lectures. It has the dosage calculations and pharmacology. And then I'll be adding mental health. Okay. So right now, that's everything in nursing school course right now. And then this is the entrance exam. If there's anybody out here that was interested in getting into nursing school, you have to take an entrance exam. Then this is the V2 for Ts. So there's a V2 for RNs, there's a V2 for PNs, there's a V2 for nursing school, and then there's a V2 for Ts. If you plan to order the PN, then you're going to click NCLEX PN right from the website. Okay. So I'm going to click it and it's going to say understanding the LPN faster. You're going to scroll down and you are going to have the 2 complete program options here, meaning that both of these packages come with the same thing. All right. So that means you're going to get the question bank in both with 2 computer adaptive testing. You're going to get next gen case studies in both. You're going to get the lectures, same lectures in both. You're going to get a physical quick facts book, and then you're going to get a digital workbook. You're going to get the daily study calendar, and then I'm going live twice a week. The only difference between these 2 packages is the price. So in this one, you're going to pay $69. This is the promotional price. It was $99. So yours is $69 right now until January the 3rd for 1 month. So that means you're going to get in. This is for the person that's going to get in and they're going to finish the course in 4 weeks. After that, if you don't finish, there is a $50 monthly renewal. Okay. So that is the 1 month option. This is the PN price. This is for PN. The $99, this is for me, this is the better option because you get $99 for 3 months. For 3 months. You get everything here just the same. You're going to get the physical quick facts and the digital book for $99 for 3 months. After the 3 months, there will be a $50 monthly renewal when you go into month 4, 5, and 6. Okay. So let's just say you want to do the 3 months. You're going to click join now. Okay. So when you do that, you will have to give me your name, your first name, last name, email, and you will create a password on this side. But right now, what I want you to pay attention to is your order summary. These are the things that you are getting. Okay. And I wish I could. I don't know if I can blow this up. Can I zoom this in? Let me see if I can zoom in really quickly. All right. Now I zoomed this in. So over here is where we are. So for the $99, and it says 10 cents here, this is because you're going to get the free gift of the first shift. And we had to make it something so it can come up. All right. So you're going to get the 3 months virtual course that includes the lectures and the question bank. You're going to get the downloadable PDF book included here. And then you're going to get quick facts. Okay. All right. Now, there are some people who already have quick facts at home. You have it in front of you right now. You've been studying from it. You only want to add the videos. If that is you, then this is what you're going to do because you do not need another quick facts if you already have one. So you would just take quick facts and you would hit this trash button here. Okay. You're going to hit the trash button. And that's going to take the price down. Okay. Almost $20. All right. So if you don't need quick facts, take it out. Now, if you want to add the physical book, some of you have the downloadable included, but you want to add the physical, this is where you do that. You do a plus sign here. And so now we know that you want the physical book. Okay? Because this doesn't automatically come with the program. The physical book does not automatically come with it. The quick facts will, but the physical one won't. Catherine, I'm doing the RN. Can I have the physical book? I have quick facts, right? So like I said, if you want that physical book, you have to add it here. So you take out quick facts and then you're going to add the physical. All right. This is how you do it. Go to remarnurse.com. And then also, if you don't want to start right away, you can delay your start date down here. All right. So right now it's December the 30th. To change your start date, you would just go to the arrow here. You can click over January. You don't have to start in all of February. And this is honestly, this is the best way to do it because this promotional price is going to be great. You don't have to start until the end of, you don't have to start until the March 30th. Okay. And if you want to, in the coupon code, we have a Remar Nurse Rep. If you put in Nurse T, look, if you put in Nurse T, let's see what kind of discount you'll get. Let me try it. Nurse T. Bam! You're going to get 10% discount. Nurse T is trying to help y'all out. Okay? All right. So this is how you are able to go ahead and get the V2. All right. And so this is if you're getting the NCLEX products for the promotional price. All right. All right. Does that make sense? I hope I helped you there. Okay. We have another class tomorrow at noon. The nursing school course can be purchased in the same way. Now, the nursing school course can be purchased in the same way. Let me just go back and do nursing school. Hold on one second. Let me go back and let's do nursing school. Because the nursing school course, I think, is a really great value if you want to have more information to study. But you can go to remarnurse.com/school. Okay. And when you go here, instead of doing the quick facts, the nursing school course, and that has the pharmacology in it. So you would have to do the nursing school course for the pharmacology. And so you have this price, and this price will absolutely be changing. So definitely, if you're considering or you just want the information in the nursing school course, this is definitely the time to do it. So nursing school, you can get the 3-month subscription or the 1-year subscription. It's the same thing. All right. After the initial 3 months, it will be $10 per month if you want to keep access to this course. And this is a course that will be growing. So I'll be putting more and more information in here. I'm gonna try to log in so you guys can see it. And then this is the $99 for 1 year subscription. So let's just say you want, I don't know, let's just say you want the $99 for 1 year. It's the same thing. So with the course, you're going to get access to all of the virtual lectures. Okay. If you want the quick facts for nursing school, you need to add it. Once I purchase the V2, I can't use the old books from Remar. No, because the V2 is going to be different than the old books. All right. So if you want the quick facts for nursing school, you add it here. And that's your price for the 1 year in nursing school, $114. And I'm really telling anybody that's interested in nursing, do not spend $6,000 to go to a nursing school and not be sure if you are able to finish it or if you actually want to do nursing. I would suggest just going in and just watching some of these videos to see, invest $39 to see if this is what you want to do. Okay. To see if this is really what you want to do, because nursing school is, it's a lot challenging, I think, than some people think that it is. It's a lot more challenging, and you have to have the mentality that I'm doing things to prepare myself for this endeavor. And that's really, I think that's really interesting. Hold on, that's something that really takes some foresight, because just because you're in nursing school, that doesn't mean that everything will be handed to you. Like you have to do a lot of this work on your own. Let me see if I can get into nursing school. Okay, so here's the nursing school course. I logged in. Let me have it save my password so I don't have to do that anymore. All right, so the nursing school V2 looks like this. The nursing school V2. All right, and so what you're going to have is 2 circles right now. You're going to have an anatomy and physiology, and then you're going to have what I call fast pass. Okay, so anatomy and physiology is literally my body systems review. Okay, so a really great breakdown of the body systems. These videos are about 20 minutes, so there is a lot here in terms of that. And then the fast pass is probably where a lot of people are interested in going into. This is the fundamentals of nursing. So this goes over what we learned in the very beginning of nursing. Okay. So admissions and discharge, assignment and delegation. These are things that also show up for NCLEX, but I go into much more detail here because the ATI requirements and FA Davis requirements are a little bit more detailed. All right. This is also part of fundamentals. It's your growth and development. So again, we go over the age groups and nursing care for the age groups. So I go over that here, all the age groups. And then the third fundamentals of nursing are more, again, the assessment factors in nursing. All right. And even here. Okay. If you're interested in direct hire, that's with Safe Nurse Now, right? Please send or go to remarnurse.com/jobs. All right. And this is the pharmacology. So my approach to pharmacology is a body system approach. I think it's great to learn classes of medications, but it is so much better to actually learn how medications affect the body systems first to be able to put those medications in there. All right. Pharmacology 3. And then the clinical math is here as well. There is a difference when you're doing liquid medications to injectable medications in terms of the calculations, electric pumps to manual pumps. So I really think if you, I'm going to do the math clinic sometime next month, but I will absolutely be taking it from here. All right. And so that is the nursing school course right now. The nursing school course also, I don't talk about this, but the nursing school course also has a question bank with over 1,000 questions in there. So you can begin to practice questions on the subjects in nursing school. Let me see what we have in here. If you go into the nursing school question bank, you're going to be able to do clinical math, fundamentals, med surg, community health, and pharmacology questions as well. Okay. All right. So those are the courses. The only one I didn't go into was the TEAS course, but those are the nursing school and the NCLEX courses for those of you who were asking. Hi, Professor Regina. Is it recommended to me review from nursing school only for review? I also graduated in 1996. I know a lot has changed since that time. So if you're doing NCLEX, I would suggest you do NCLEX, right? Because that's going to be geared towards your state exam, which is a more important exam for you to focus on. In terms of most of the stuff changing since 1996, it has not. The human body is still the same. There have been no new discoveries at all on the human body. No new parts have sprung up. No new organs or anything like that have changed drastically. So you don't have to worry about that. Okay. You can do the nursing school course for more extended learning. However, I would put you in the NCLEX review course first. Start there. Okay. Because it's a more abbreviated review. The nursing school course, like I said, is much more detailed. All right. I'm so glad you added this. I needed it. All right. Cool. If you have the V2, but you want to subscribe to nursing school, is it possible? It is possible. I will say, though, you can't have the same email for 2 V2 places. So you would just use a different email if you want to get the nursing school course. Make sense? All right. Thank you so much. This is my heart. This is my love. I love what I do. Oh, it's 1:30. Okay. I have a meeting that I have to go to in just 30 minutes. So let me go. Let me retire on this day. I will be back tomorrow, though, and we will pick up with the 7 days of NCLEX. We're on the 6th shift. God bless you all. Have a happy Monday. And thank you for joining me today. We did newborn concepts. And so I enjoyed it. I really did. We got 6th shift coming up tomorrow at noon. I will see you there. Bye-bye.